Ultimately, I lost a brother, but I'd argue that I lost part of my parents, part of my other brother. Just my family was completely changed.
DePaul
Just
sophomore Carly Spielberg's life changed 2 years ago when she got a phone call saying her brother had overdosed on heroin and died. Heroin addictions don't just affect the addict, they affect families, friends, and the entire community.
Last 10 years or so, there's been a 400% increase in deaths as a result of overdose to opiates and prescription opiates and heroin. So about 18,000 deaths from prescription opiates, about 9,000 from heroin.
Addiction specialist Dr. Michael Bollinger of President's Healthcare says heroin addiction has spiked dramatically in recent years.
Opioid epidemic, as we're describing it now, involves a recent run-up, maybe in the last, actually it's been over 20 years, but in the last 10 years, a dramatic increase in deaths and addiction to prescription opioid medication and the introduction of people who become addicted to prescription opioids to heroin.
Prescription opiates like Oxycontin and Vicodin were developed to help patients manage severe pain. With 1 in 3 Americans suffering from some variation of pain, doctors prescribe these medications because they provide almost instant relief. But tragically, some people get addicted to these painkillers. Dr. Leonard Jason, Director of Community Research and Psychology Professor at DePaul University, has been studying addiction for 25 years. His expertise has shown there are flaws in the healthcare system.
The problem is too much of it is going on, too many prescriptions, and too much of the problem is really part of the medical system.
The problem our nation is facing is that these painkillers affect the brain the same way as heroin. So when these addicts lose access to their prescriptions, they're still addicted and turn to the highly addictive, less expensive, and illegal counterpart, heroin.
These young people and older people who get addicted to heroin, it changes their lifestyle completely so that their world becomes getting enough money to get that next fix.
Spielberg remembers the way her brother described the drug.
The absolute greatest feeling in the entire world. And he's like, from that point on, it's the only thing that you want. Like, that is the one thing that you want back. And you can't ever have that feeling that you got the first time that you used it. So it's just, trying again and again, but you'll never get there.
Some of those personally affected by this drug epidemic say people need to be educated more on the danger of opiate use. DePaul senior Gabby Hillman, whose cousin overdosed on heroin, says drug education must go beyond grade school and middle school. She says it also needs to be stressed even in high school and college when drugs become more accessible.
You get older and you're more aware of things, that type of education goes away. And you don't have DARE when you're in high school and when you're in college, and you don't even have any sort of awareness like that of what the real side effects are, and that it really, it takes one time to get hooked and it takes one time to die from it. So
Dr. Jason believes our healthcare system is not devoting the resources needed to fight this crisis.
We should think about drug addiction like any other health problem, just like cancer, just like HIV. Drug addiction is a health problem. It should be dealt with compassionately. We should have the resources available to help people with heroin and other types of problems get off their addictions. But our health care system is broken, and that's the problem.
There's no easy solution to this problem, but experts as well as those personally affected say something must be done.
this is a public health matter. This is an epidemic. People are dying because of it, and it's not being addressed.
The opioid epidemic is a complex issue that affects the country on multiple levels. Yet, as people continue to die, neither lawmakers nor the National Institute on Drug Abuse have a good solution to the problem. For Good Day DePaul, I'm Sydney Bickle.